السلام عليكم ورحمة الله وبركاته. أنا دكتور زين شيب العابدي، General Surgery and Laparoscopic Consultant. بسم الله الرحمن الرحيم، ويسألونك عن الروح من أمر ربي وما أتيتم من العلم إلا قليلا. صدق الله العلي العظيم. محاضرتنا اليوم عن الجويتر. الجويتر موضوع مهم وراح نناقشه في إطار محاضرتنا هذا اليوم. محاضرتنا راح تكون أو تنعرض خلال نص ساعة، تتضمن عروض فيديوية ومناقشات وصور تعريفية للموضوع. General objective of our lecture: to produce a medical graduate with knowledge and skills to deal with the patients of a thyroid disease. Specific objective: at the end of our lecture, our student will be able to define a goiter, remember the most common causes of the goiter, manage the goiter, and compare between the type of thyroid enlargement. عندنا هذا الفيديو اللي تشوفوه.
تشيلسي شابة بريطانية عاملة ومسؤولة على أسرة، كانت تعيش حياة طبيعية إلى أن بدأت تلاحظ أعراضاً غريبة على جسدها، من إحساس بالتعب الشديد، زيادة في الوزن، جفاف في البشرة، وعدم القدرة على النوم ليلاً، والذي أجبرها على ترك وظيفتها. أعراض غيرت من حياتها، ما دفعها إلى زيارة الطبيب الذي أخبرها بعد إجراء التحاليل أن لديها خللاً في وظيفة الغدة الدرقية، وأن عليها تناول الدواء مدى الحياة. الخبر صعق تشيلسي التي بدأت في تناول الدواء ومراجعة الطبيب كل 6 أشهر لمراقبة حالتها، إلا أنها سرعان ما سئمت من الوضع وقررت البدء في رحلة بحث عن أساس المشكلة، إلى أن وصلت إلى قرار شجاع وهو التوقف نهائياً عن تناول الدواء، وصاغت حمية غذائية أساسها الابتعاد عن اللحوم، الابتعاد عن الحليب ومشتقاته عدا تلك التي يكون أصلها نباتي، تجنب السكريات، تناول الأغذية الخالية من البروتين، فضلاً عن ممارسة الرياضة من ركض وسباحة. بدأت تشيلسي تلاحظ تدريجياً تحسناً في حالتها، وبعد 6 أشهر ولدى إجراء التحاليل اندهش الطبيب من النتائج، وأصبح هو من يسأل إن قامت بأي جديد، فأخبرته بالحقيقة فأذهلته. والآن تشيلسي تستمتع وللعام الثالث على التوالي بصحة جيدة. قصة ملهمة بشجاعتها، وتبين أن الغذاء والرياضة أحسن دواء لكذا داء.
طلاب شفتوا انتم هذا الفيديو؟ طيب شوفوا كيف.
Change of lifestyle is more important.
للسيمبتومز. إذن الفكرة إنه there is يعني a rule in the treatment of the goiter with modification of the lifestyle and tradition. Definition: the word goiter or goiter in Europe derives from the Latin word guitar, but the meaning has shifted from the throat or the neck to mean specifically an enlarged thyroid gland. In general, goiter defined as diffuse enlargement of the thyroid gland, and this enlargement may be related to the changing in the thyroid function test or thyroid hormone, or may be unrelated. يعني ممكن المريض euthyroid with thyroid enlargement. Sometimes thyroid cells will increase thyroid hormone or decrease thyroid hormone. About the anatomy of the thyroid gland. Thyroid gland normally represented in the neck in the anterior part of the neck between the supracell notch and the chin. About the blood supply of thyroid gland, there is 3 arteries supply the thyroid gland: superior thyroid artery, inferior thyroid artery, and thyroid inner artery. And the venous drainage was accordingly to the artery: superior thyroid vein, inferior thyroid vein, and brachiocephalic trunk. About the nerve supply of thyroid gland, we have 3 nerves related to the thyroid gland. The most common nerve was recurrent laryngeal nerve, and the superior or external branch of the superior laryngeal nerve, and thyrocephalic trunk. من يقدر يحكي لنا النيرفز اللي هي related to the thyroid gland؟ تفضل. Excellent. We have a hypothalamic pituitary thyroid axis between the hypothalamus اللي يعطينا الثايرويد releasing hormone, pituitary gland اللي تعطينا thyroid stimulating hormone, and thyroid gland secreted T3 and T4. State of the thyroid hormone synthesis or formation. First, iodine uptake. Thyroid follicular cell actively transport iodine from the blood stream. Iodine is then transported across the apical membrane of a follicular cell into the colloid. Then iodine oxidation within the colloid, the enzyme thyroid peroxidase oxidize iodine to the iodine. The iodine then bind to the tyrosine to formation of monoiodotyrosine or diiodotyrosine. Coupling of 2 particles of diiodotyrosine form T4, while coupling of 1 monoiodotyrosine with 2 iodotyrosine form T3. What about the function of the thyroid gland? First, thyroid gland function related to the growth and development of the organ of the body. The most affected organ in its development by thyroid gland is the brain. Also, there is effect of the thyroid hormone to the heart by affecting the heart rate, body temperature regulation, muscle control, digestive function. They affected how food moves from the oral cavity to the anal verge, also related to the bone health and imbalance in the body with the producing of the calcitonin hormone regulating the calcium level. What about the causes of the thyroid enlargement? First, simple goiter, diffuse hyperplastic goiter, simple multinodular goiter. Then, toxic goiter included grave disease, toxic multinodular, toxic nodule, infection and inflammatory, اللي هو the most common cause of the thyroid enlargement. Infection and inflammatory cause. Bacterial, viral, fungal, autoimmune, tumor, benign, and malignant cause of increasing the thyroid gland size or enlargement. Clinical feature of the thyroid enlargement. First, presence of the lump in the neck. Feeling of tightness, and heaviness. Hoarseness, neck pain distension or swelling. Dizziness, difficulty in breathing. Coughing, wheezing, and some sort of difficulty of swallowing. What about the symptom of the hyperthyroidism? Hyperthyroidism means an increasing in the production of diiodothyroxine and monoiodothyroxine, T3 and T4. Tachycardia, which is meaning increasing in the heart rate. We know the normal value of the heart rate is between 72 up to 96. When there is increasing in the number of the heart rate more than 100, this is meaning the tachycardia. Unexplained weight loss, diarrhea, sweating, increasing appetite, agitation, tremor, eye sign and hand sign, and hot intolerance. This is a diagram or the picture shows the effect of the increasing the level of thyroid hormone in the body. The nervous system, weight loss, shaking hand or tremor, warm or moist skin, broken hair loss, enlarged thyroid gland, increasing heart rate, arrhythmia, high blood pressure, and muscle cramp or weakness. This is picture show manipulation of it.
زفر
What do you mean by the exercise?
perfusion of the
Excellent. Symptom of hypothyroidism. Hypothyroidism means failure of thyroid hormone production in the level and the function. Fatigue, constipation, dry skin, unexplained weight gain. بالhyperthyroidism عندنا unexplained weight loss. بالhyperthyroidism unexplained weight gain. تمام؟ Abnormal menstruation, decreased appetite, weight gain, hyporeflexia, cold interest, and muscle weakness and cramps. This is the effect of the hypothyroidism or thyroid failure in the body system. Depression, fatigue, weight gain, cold illness, joint and muscle pain, irregular or heavy cycle or menstruation, constipation, dry skin, and mammary decline. What about the differential diagnosis of the neck mass? Enlargement of
inflammatory mass tumor.
excellent. هذه question جاوبنا على هذا الباب. أنا نزلتكم بالكلاس روم. Investigation or management of thyroid gland. All type of management for any insult depend on three criteria: investigation, clinical history and examination, investigation, and imaging study, and then treatment. Regarding the investigation of the thyroid, we have here most modern effective way of investigation for thyroid function, including thyroid stimulating hormone, T3 and T4. When there is increase in the level of synthesis of thyroid hormone, being hyperthyroidism, when there is normal finding of thyroid hormone in the lab study or investigations, euthyroid, and when there is decreasing or increasing in the TSH, there is a thyroid failure. What about the imaging study regarding the diagnosis of the goiter or thyroid gland? The first and most sensitive and effective way of diagnosis of thyroid enlargement is the ultrasound. Ultrasound is effective sensitivity and specificity in thyroid enlargement up to 90%. whether hematoma, colloid, cyst, single or multiple nodule, all of these insults can be detected by the ultrasound. In this X-ray, which is one of the way of imaging study for the diagnosis of thyroid enlargement, ممكن واحد ما تحكينا الفايندينج في الإكس-راي right on the patient. Large goiter, large mediastinum. The finding of the chest X-ray in case of the thyroid enlargement. First, tracheal deviation. Second, اللي هو retro-sternal manifestation of the thyroid mass of thyroid gland or goiter. Third, هو the presence or absence of secondaries. واضح؟ FNA is one of the way of minimally invasive technique in the diagnosis of many diseases. One of these diseases is thyroid enlargement. FNA specificity and sensitivity in case of the thyroid gland enlargement is up to 50%. That there is 50% false negative and false positive. But still, the way for the diagnosis for a pre-malignant condition of the thyroid nodule enlargement. CT scan. CT scan can show the large complex masses in the side of the neck that's related to the thyroid gland or to the another organ. One benefit of CT scan can show the goiter is compressed, the trachea, esophagus, and blood supply. Evaluation if there is any suspicion of malignancy. If there is concern that the goiter might be cancer, CT scan can help or assessment for the sign of the invasion of the thyroid malignancy. This is the video showed the neck compartment. من أكشن الفايندينج اللي شافها بالسيتي.
Anterior neck mass. Goiter, thyroid extension.
Related to
Related to the trachea.
the trachea and to the thyroid. اللي قلناه قبل إنه وين connection to the thyroid gland, the pressure on the blood supply of the gland. Radioactive iodide uptake is one of the way. When there is absorption or uptaking of the radioactive iodide by the mass, that's mean this is unsure. شعلين إنه hyperactive. When there is the same with the tissue and the mass, when the tissue takes the dye more than the mass, cold treatment of the gout. In any disease of the body, there is two rules of the treatment, either conservative or surgical. Regarding the conservative treatment of the thyroid gland enlargement or thyroid gland hormonal disturbance, according to the insulin, when there is a hyperthyroidism, the drug that used different from the drug used in the hypothyroidism. Both of them anti-thyroid drugs. Patient with the hypothyroidism treated with the fellow may be increasing or decreasing according to the finding of the evaluation of the lab finding for the thyroid hormone. Patient with hyperthyroidism treated with antithyroid drugs, beta blocker, and radioactive iodine therapy. هنا surgical indication of the thyroid gland enlargement. What about the surgical?
Area obstruction.
When the patient is symptomatic. Symptomatic. Patient is symptomatic. Hypoxia, difficulty of swallowing, difficulty of breathing. Second, cosmetic or patient wishes. رغبة المريض بالعملية ممكن تضطر للعمل. Indication of the surgery. First indication one, finding of the feature of malignancy, whether by ultrasound, by CT, or by FM. What are the findings that make the thyroid gland suspicious of malignancy? Pain, painless mass, hoarseness, voice changes, lymph node enlargement, rapid enlargement, family history, age more than 4. Suspicious FNA, compressive symptom, hyperthyroidism, large goiter, and cosmetic fixing. Surgical treatment of the goiter, we have 3 options of the surgery for thyroid gland. First option, lobotomy. Second option, subtotal thyroid. Third option, total thyroid. For any way of intervention, we have to prepare the patient for the surgery. Preparation of the patient for the surgery, including specific preparation for thyroid gland and general or routine preparation for the surgery in general. We have to do complete blood count or complete blood pressure. We have to do liver function test, SGOT, SGPT, alkaline phosphatase test, renal function test involving blood urea, serum creatinine, and TSP. This is in general. While specific for the patient of thyroid gland, first of all, send the patient for ENT evaluation of the problem. Okay. For the case of hypothyroidism, we are already in the thyroid. While in the case of hyperthyroidism, the preparation method including antithyroid gland, which is carbimazole, for up to 8 to 12 weeks in a high dose with beta blocker and locus iodide up to 2 weeks pre-intervention for decreasing vascularity of the gland. Type of intervention: total, near total, subtotal, or lobotomy. Surgical approach. We have the common approach, which is an open way in order to get our target or to do our intervention. Another option, which is a new option, what we call minimally invasive technique in case of the surgical intervention of the goiter or thyroid enlargement, endoscopic thyroidectomy. Another option, which rarely used, will use transoral therapy. And the last one is robotic therapy. Regarding the postoperative complication of the thyroid gland, the most serious complication is bleeding, respiratory obstruction, nerve injury. The most common nerve injury during the thyroidectomy, recurrent. Another nerve may be injured during the thyroidectomy, external branch of the superior laryngeal nerve. Hyperparathyroidism. Hypoparathyroidism. During the thyroidectomy, you may injure or interfere with the blood supply of parathyroid gland, which is mainly responsible for the synthesis or secretion of the calcium. When this injury occurs, they leading to the what we call it hypocalcemia. It's one of the most complications of thyroid. Thyroidosis crisis, complication of the wound, and hypothyroidism, which is a common result of the thyroid. I can deal with it or control with thyroid. Post-operative care of the thyroid. First, dose observation of vital sign, checking sign of bleeding, hematoma, and sign of hypocalcemia. Monitoring of any respiratory distress, monitoring of the calcium level, assess voice quality for the patient, vocal cord damage, pain management, wound care, and therapy. Video show the evaluation of the vocal cord post thyroidectomy. You can see behind it, there is bilateral mobile active vocal cord. So, thyroid disease is a common disease, especially in women. Early diagnosis and treatment mainly essential for prevent of the complication of the thyroid. Blood test for a thyroid hormone is the main way to detect the disturbance in the level of the hormone. Treatment option including medication, radiotherapy, and lastly, surgery. Thyroid disease can greatly affect the person's quality of life. Regular checking with your doctor are important for the control. أيوة هذا السؤال. As we see above and discuss, the most commonly affected by the surgical complication of thyroid enlargement, recurrent laryngeal nerve. The second most affected nerve is the branch of superior laryngeal nerve. هذا homework لكم. What are the serious complication of thyroidectomy؟ شفناها وجزوناها على هذا الكلاسروم هذا البرد.
Regarding the victim at the start of the what's the diagnosis of this case?
Diagnosis of FNC, what we call physiological hypothyroidism or subclinical hypothyroidism. بالمناسبة الفيديو اللي عرضناه بالبداية 3 or 4 monkeys واحنا ما نعرف الوي اوف diagnosis. ما عندنا imaging study ما عندنا thyroid function. This changes may be due to pregnancy. يعني اللي حكيناه في القصه بالفيديو الاول انه احنا الموديفيكيشن اوف لايف ستايل and the management of the goiter went off state, not a definitive way of treatment of thyroid or goiter. Not treatment, but thyroid and surgical intervention.
So the option for the thyroid
Our choice of way of intervention depending on the finding in the pre-operative assessment. FNA, CT, X-ray, ultrasound. هذا يعتمد انه يعطينا هنت انه هذا indication for thyroid, thyroidectomy total or for the subtotal or mean total according to the suspicion or the finding of pregnancy or not. طبعا هذا السؤال بقى شباب ممنونين وعشديكم شكرا.